understand whether our body needs more water or what is the right amount of water to be taken?
For that you have to listen to your kidneys only.
Achha.
What I tell to all my patients, you have to see the color of your urine.
Drinking 8 glasses of water a day is perfect amount for everyone, with or fact.
Yeah, it's a partial with and partial fact. Your absolute numbers do not hold any significance. I told you earlier, because 8 glass of water will be very less for a person working outside in a field in Mumbai, but that will be very much higher for a person who will be working in Nashik. No medicine is harmless.
Safe.
No medicine is safe. From my perspective, any medicine on the earth is unsafe. But you have to believe on the buffering capacity of the kidney. But painkillers are the greatest villains. Something like Shakal. They are Gabbar and Shakal. So they will be causing more damage to the kidney. For those suffering from hypertension, they should be limiting their salt intake as low as possible. And all those who are suffering from kidney disease, they should be limiting their salt intake very drastically. At the end, salt is what is putting more strain on your kidneys other than any other chemical or any other food ingredient. So low sodium salt is very harmful for all those patients who are suffering from kidney disease, because high potassium levels in the blood is fatal thing.
Is again another. Kidney disease, often called as a silent killer, because it can progress unnoticed until serious damage has occurred. Understanding the early warning signs and adopting simple habits can make all the difference in protecting your kidney health. In this episode, we'll explore why kidney disease is so hard to detect at the first place, the importance of routine screenings, especially if you have other risk factors like diabetes or blood pressure, and practical steps you can take every day to support a healthy kidney. From hydration myths to the impact of common medications, this conversation will equip you with essential knowledge to safeguard one of your body's most vital organs. Joining us today, we have Dr. Ajay Naxane, a highly experienced nephrologist with over 15 plus years of expertise in managing complex kidney diseases. Dr. Naxane brings in-depth experience in dialysis, chronic kidney disease, also known as CKD, and renal transplantations. He has also served as a medical educator for postgraduate and super specialty students and holds an LLB degree contributing research on medical legal aspects of healthcare. Dr. Naxane blends clinical excellence with academic insight and a deep commitment to patient care. Welcoming Dr. Ajay Naxane. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita and today we have with us Dr. Ajay Naxane.
Hi.
Hello, sir.
Hello. Hi.
How are you?
I'm fine.
Welcome on Sahyadri Health Talks. So today we are going to talk about kidney health, and rather than talking about a particular ailment or a condition in kidney, हमने decide किया कि आज हम preventive measures के बारे में बात करेंगे.
That is the crux of diagnosis. That is the crux of managing kidney disease actually.
Yes, because often kidney diseases are diagnosed very late. Yeah. So without wasting any further time, let's dive deep into today's topic. So we will start from something very basic, which is like kidney issues are always called as कि ये बड़े silent होते हैं and they don't show up any symptoms. So why is it so, and why why are almost all kidney issues diagnosed at a very last stage?
So before diving into the pathology, which the question from you pertains to the pathology, why the kidney disease is there and why the kidney disease is diagnosed later on. I want you to understand something very basic. Soren Kierkegaard, a philosopher, once said that life can be understood only backwards. It has to be lived forwards, but it can be understood only backwards. So if we want to understand what actually kidney does in our body, so that we may be able to understand what is the pathology and why the kidney disease is diagnosed at a later stage, we need to go back around a million years back, I will say. When we migrated from the seawater onto the land, the main adaptation or the main thing which required for us to live on the land was the kidney, because the kidneys adapted themselves so that the majority of the blood constituents or biochemical composition in the body remains stable, we could just evolve. And brain evolved and heart evolved. As you know, there are very celebrity organs. Like the brain is a celebrity organ, the heart is a celebrity organ.
Yes.
They cry for an attention. The kidneys is not like that. They work on the background. They are like beyond the scenes worker. Um, when you only understand their importance when they are not there.
Correct.
When our film goes for the editing, if the editing is not properly, you don't there is disconnect, something like that. But you won't be noticing it very early. So something like that. Now what happens? The kidney has adapted so precisely. The biochemical reports or the blood volume and the blood composition is kept in such a precise manner that you don't get the symptoms of the disease unless they are disturbed to very large extent. Now about the kidney disease, what happens? The kidney has a large buffering capacity. Kidney is a resilient organ, I will say, and the body gets adapted to the dysfunction when it is just creepingly increasing. If the kidneys are failing very creepingly, very slowly and very gradually, body gets adapted to it.
Achha.
Actually, that is the crux of our evolution, I will say. As the human beings got adapted to the challenges in the environment, they evolved. Something like that. And that is actually the main problem why the disease is diagnosed in a later stage. What happens? Kidneys are failing very gradually. The body is getting adapted to the toxic milieu, the toxic internal composition of the blood. And the symptoms usually do not get manifested at that stage. So when we say that the person is suffering from any kidney disease, the symptoms what we get, those symptoms are manifested only when the kidneys are damaged beyond 90%.
Achha.
So that is the reason the kidney disease is also called as silent killer. Silent because it does not make a noise. Even it does not whisper. It just comes gradually. It is sitting in your room. It is encroaching in your space, and it is like killing all your resources. So unless and until till the time you get to know that your internal body or internal environment is getting affected, you don't get the symptoms. So in a single line or a single statement, what I would like to say, the kidneys, when they are affected or when they are crying or when the body is crying for normal internal environment, so kidneys are damaged to the 90% of their what capacity should be. So that is the reason the kidney disease is damaged very late. The kidney disease is diagnosed very late because the kidneys are very resilient. They have a high buffering capacity, and majority of the functions which the kidneys lose in the earlier stages can be taken care of other organs also. So body gets adapted to that, and that's why what I mean by adaptation. So ऐसा है कि वो काफी शांत है, तो किडनीज तभी रोना चालू कर देती है जब वो 90% डिस्ट्रॉय हो जाती है. So that is the reason.
Because the overall, the phenomenon, this entire thing which you have explained, ये अपने में इतना complex है, and by the time the symptoms are really seen, as you're saying that maybe more than 90% damage is already done. So ऐसी कौन सी चीजें हैं and ऐसी कौन सी parameters या फिर symptoms या फिर signs body देती है that one should look out for in day-to-day life?
See, many a times, I would like to categorize the patients according to the risk factors.
Hanji.
Majority of the people who suffer from the kidney disease are suffering from some other chronic ailment such as
like
diabetes, hypertension, recurrent renal stones and all. So what happens if we are not looking actually at the values or the numbers of the diabetes control, like the blood sugars, if you are not looking at the numbers of your blood pressure control, like the upper blood pressure limit and the lower blood pressure limit, actually we are not listening to the whispers what the kidney is telling you, that look at these values
which are abnormal.
Which are abnormal. Now these values are going to kill me, and when these values will kill me, I will lead to my demise. Then you won't be able to do much things. So what the crux of whatever I am saying is that you have to look at your numbers. So all those patients who are suffering from the diabetes, those are at high risk to develop kidney disease.
Achha.
So you should be having very strict blood sugar control, like fasting blood sugar has to be around 120 milligrams, and postprandial has to be around 140 to 160 milligrams. For the blood pressure, nowadays the recent guidelines are saying lower the better. Lower the better means whatever the level you can tolerate, your body can tolerate without getting any symptoms. Those numbers are better for you to prevent all the chronic complications of end organ damage like kidney dysfunction and all. So how to know that your kidneys are getting affected, or how to prevent kidneys from getting affected from the disease, is to look at all the causes which are causing the kidney damage. So most commonly the diabetes is causing kidney damage, most commonly blood pressure is causing kidney damage. So you have to be alert to the values, to the numbers which they are telling. I mean, everybody is saying that no, diabetes मैं तो सब कुछ खा लेता हूँ, मुझे कोई शुगर का प्रॉब्लम नहीं है. They wait for the symptoms to occur. Even in diabetes and blood pressure, symptoms usually do not occur at minor, variations. When patients get headache and when patients get, complications because of the hypertension, I will say. So their hypertension has been there for very long, like the systolic values of more than 200, systolic values of more than 180. Only these values will give you symptoms. But the damage, maximum damage which will be caused by the hypertension, the maximum values lies between 140 to 180. So you have to look into those numbers. You have to keep those numbers within the permissible range and within the range which the guidelines suggest. So you have to look into your values. You have to look for the causes which are causing you the kidney disease, which are causing the kidney disease, and you should be keeping those numbers within the limits. Achha. So that's what we should be looking at. The other important preventable aspect is renal stone and the other over-the-counter medications. Many a time it becomes very easy for us to go to a pharmacist and you tell him that I'm getting a headache, I'm getting these symptoms, and I'm getting that symptoms. So he will just prescribe you off the label. I mean, all the medicines he will give you.
Yeah, over-the-counter painkillers are very easily available.
Yeah, those are very easily available. At the end, you have to understand these are all the chemicals.
And it gets flushed out through kidney.
Yeah. A kidney is your sewage system or water treatment plant, I will say, in simple language to understand the analogy. So whatever you are putting in has to pass through your sewage system.
Correct.
If the kidneys are handling this large number of this large number of waste products which your body is producing naturally, and above that, you're like stressing,
you're overburdening it with
overburdening and stressing
painkillers and chemicals.
These are all the chemicals at the end. These are not like amrut coming from anywhere. So these are going to damage your kidneys. So you have to be very cautious about using these medicines. There is no medicine on this earth which does not cause any kidney problem. A simple medicine such as pantoprazole, or a medicine to treat your gas or to treat your constipation, even these drugs can cause a kidney damage. As I told you earlier, the kidneys are very resilient. They have a very high buffering capacity. So most of the damages do not manifest into the symptoms. So kidneys repair itself. Just like the liver repairs itself, the kidneys also repairs itself. And you just feel something, generalized weakness, pain here and there, and then later on the symptoms go away because kidneys has repaired.
Correct.
So kidney like, tu nahi sun raha, I will repair myself, but I will keep you alive.
Yeah.
Something like what our parents do. We don't listen to them, but they are always for our own
But they don't give up on us.
Yeah, they don't give up on us. That's what the kidneys are doing. So that is the thing. You should not be addicted, or you should not go for over-the-counter drugs or unprescribed drugs. Thirdly, now there is a fad of taking all the nutraceuticals or all the drugs, supplements and all. As I told you earlier, everything which goes into the blood has to pass through the kidneys.
Yes.
So whatever is causing effect to your organs has a propensity or has a tendency to cause damage to your kidneys also. So you have to look into that aspect from that perspective, from your kidney health perspective also. Correct. So these are the things. Now about hydration we will be talking about it later.
Yeah, we will talk about it later. So before we get into the hydration part of it, because that is also a very important discussion which we wanted to have, I'll just quickly brush up and finish on the part that what would be some routine tests.
Okay.
So what would be some routine tests that you strongly recommend to all the categories of patients? So when I say all the category of patients, one patient who has no history of family history or comorbidities like diabetes or blood sugar or blood pressure, what are the tests that these category of patients should get done routinely in annually? What are the tests which people with comorbidities and family history of kidney issues should get it done? So what would be the tests for these two categories?
As we discussed earlier, that the kidneys do not get damaged upfrontly. there is a subclinical damage. So what we are looking at when we are screening for kidney damage is the subclinical damage. So what are the earliest manifestations which may be pointing and which may be telling that the kidneys is getting affected or kidneys are getting stressed out?
Acha.
So there are some lab parameters only. You won't be getting any symptoms unless and until these subclinical lab parameters are going into clinical range, and these are out of the range, and
Okay.
5 times to 6 times what it should be in your body. So what are the subclinical parameters which we should be looking or screening so that we get
A
hold
fair
of the kidney
idea
disease? Yeah.
of
So
the
what I will suggest to get your urine checked.
Acha.
So in urine, a routine microscopy report will be sufficient for most of the people.
Acha.
And those people who are at high risk, such as diabetes
and other
hypertension, and those people who are having family history of kidney diseases, those should be checking for their urine microalbumin levels. Microalbumin
which is the protein in the urine.
Yeah, protein in the urine. Yeah, that's the urine. The microscopic level, or the levels which we cannot detect in the routine checkup, we have to look into that. So that is urine micral test. That is actually proprietary and brand name of it. But you have at the end you have to look for the smallest quantity of microalbumin which is passing through the urine.
Achha.
If you are following that report, and if you are seeing there is an increasing
albumin
concentration, so that is the level where.
So that's a red flag.
Yeah, that's a red flag. That is the first thing. Second is the creatinine levels.
Achha.
So actually, there, nephrologists are, referred, or nephrologists are called upon to see the patients only when these kind of creatinine reports are there.
So what level of creatinines are okay?
See, it all depends upon your body morphology. If you are a muscular person, the creatinine level of 1.4 milligrams per deciliter is good for you. I mean, it's okay for you. And it also depends on what method you are using to check your creatinine. There are various methods available.
Or urine.
No, within the blood also there are various biochemical technical tests. Achha. So you have to always not look at the absolute value, but you have to look into the range what the lab is giving you. So if some lab, some standard labs are giving a higher limit of the highest value of 1.2 to be normal. So if your creatinine is 1.3, that is high for that lab. But some of the labs are giving 1.5 because they are using different method to estimate that creatinine.
Correct.
So a lab value of 1.3 is normal for that lab. So there is no absolute thing, but a general thing you can say that for a male, a muscular person, 1.4 milligrams, less than 1.4 milligrams is okay. Okay. And for females, it is 1.2 milligrams, less than 1.2 milligrams.
Anything above 1.2 milligrams for a female, it should be brought to an attention to a nephrologist.
Yeah, it should be brought to an attention to her physician.
A physician at the first place.
And then they should be alerted, and they should get all those investigations done so that any subclinical damages which is occurring in that particular person or in that particular patient are diagnosed at the earlier stages. We have therapies.
Once we get these levels, like suppose I get my levels checked, creatinine levels as you said, and it shows 1.3. My 1.2 is the normal level. I mean, okay levels for me. Suppose it comes as 1.3 for me. What is the next step which is done after this?
The next step is to go to a doctor. Achha. Preferably, if you have an access to a nephrologist, you should go to a nephrologist.
हाँ, वो तो चले गए हम आपके पास. तो उसके बाद कौन से टेस्ट कहे जाते हैं?
Then the nephrologist will assess your risk level for for developing a kidney disease. The risk levels depends on various factors. The factors such as your family history, the factors such as your comorbidities. If you are at high risk, then a nephrologist will ask you to get some more tests. So tests and more tests actually. So he will particularly look for microalbumin in the urine, and then if there are other red flags in the history, or you have other comorbidities and you are in the higher risk category than the normal person, then he may look into those other risk factors, whether those risk factors are controlled or how much aggravating those risk factors are for your body. So routinely we advise for sonography of the abdomen along with the kidneys. We routinely go for some of the tests such as screening for diabetes if they have a diabetic history for a diabetes in the family. We also screen for uric acid and other tests which put you in particular risk category. So these are the tests. So what if you have a higher creatinine level? The creatinine level which is beyond your higher upper normal range or normal limit, then we will try to assess your risk for developing kidney disease. So that's the next step. So you need to get your risk assessed, and if you are at the higher risk, then if something can be done at that particular stage, we will be doing that thing. I mean, some therapeutic intervention is required, we will be doing the therapeutic intervention. And if it is not possible to have any therapeutic intervention, I mean, you are at higher risk but you do not have a disease, so we will just tell you that you maintain your body weight within normal range, you leave all those sinful activities like smoking, alcohol and all those things which put you which if you are not at which exposes you at the higher risk. So that counseling will be done, some lifestyle modifications will be done, and preferably we follow them up, so that we are doing those reports in a serial manner. So it is just a preventive thing. It's not you are at a higher risk, but you need to get alerted that you may develop that kidney disease at a later stage. So that's what you should be doing. And the other thing, actually a basic simple once a month annual whole body checkup. Whole body checkup includes all the urine and that most of the time suffices. For you to assess your all the organs health, and we have diagnosed many of the patients suffering from subclinical kidney damages just after seeing all those reports,
the whole body regular health check reports.
And I always tell to the patients, or I always tell to the relatives who come to me with the patients, that just like you are celebrating your birthday once a year, you remember your birthday, whatever the date you will be remembering, your anniversary date or birthday or anything, you just go there, you reserve your day for that, your health checkup, annual health checkup, and do that. And you need not go to a hospital and wait there for 4 or 6 hours. You just go to the lab, get your blood and urine tests. That's all.
Just a basic,
basic
blood and urine culture.
Yeah. And if you get any abnormal reports, then you have to go visit your own physician or a nephrologist, whatever other reports.
So one more aspect which is very commonly seen, and this symptom is something which many patients might have told you, is frothy urine or foam in the urine. So what does that indicate?
Actually, foam in the urine is a very, I will say, not a difficult thing, but a confusing thing. Confusing in the sense, many a times, the foam in the urine is what they see when they have went to the washroom, a Western type of commode, and they usually put a detergent in that. Just so that as a deodorant thing or as a cleaning agent, and they, whenever they are passing the urine in that Western commode thing, they say the foam. So you have to be very much sure that that is not the case. First thing, if it is a pathological thing, it will appear everywhere, and the foam does not go away. Foam, and along with the foam, there are other symptoms also. Patient may develop dependent edema. Edema in the sense the volume. Your legs are swollen. You will be getting swelling surrounding the eyes. Surrounding the
puffiness.
Eyes. Puffiness around the eyes. And puffiness around the eyes is the earliest symptom which you will be seeing if you are suffering from any kidney disease. So you have to be you should be alerted if you are seeing puffy eyelids when you wake up. And you also have that frothy urine. Frothy urine actually is a protein in the urine. So protein reduces the surface tension of the urine, and that causes a froth.
Can there be any other condition which mimics this apart from protein in the urine? Can there be any other condition which mimics foam urine?
No. Usually, I'm not aware of all the reasons, but I will be 95% sure that if you have a froth in the urine, I will be looking for a protein in the urine. So if there is a froth in the urine, you have to look for protein in the urine. That may be level at the level of a microalbumin, or that may at the level of macroalbumin. Like grossly in routine urine checkup also, you will be getting protein. So if there is a frothy urine, you have to go to the doctor, get yourself checked for protein in the urine, which is an earlier marker for kidney damage than all those creatinine and other biochemical values. So you have to look for that thing. Second, if you have risk factors to develop kidney disease, such as diabetes, so froth in the urine is a marker for diabetic kidney disease. So if you have a froth in the urine, you should go to the doctor. You should tell him that these are the symptoms, and I want myself to be checked for my kidney problem. So that is the thing. So that is one of the earlier markers. Then there are other things also, like fishy smell or unusual, very
foul
peculiar, foul smelling urine. usually that manifests physiologically also. You can get foul smelling urine. At the end, what I earlier told you, that urine, I mean kidneys are your sewage system. Whatever you are putting inside the body will be getting out through the urine. So if you are eating something having a peculiar smell, and that is I will say some kind of fish. Bengal people eat lots of fish, so that fish usually carries a kind of distinct aroma, and that aroma is that aromatic products are excreted through the kidney. So the urine also smells something peculiar after you eat non-vegetarian food. Yeah, certain kind of fish and seafoods. Yeah. But if it is persistent and if it is not related to your food habit, then you should go and get yourself checked. A urinary tract infection, that is an infection in the urine, is the most common reason or most common etiology for foul smelling urine. There are other etiologies also, but the basic thing, if you are foul smelling or very unusually smelling and it is persistent and not related to any of the dietary habits or any food products, then you have to get yourself checked for any infection in the urine.
So now the last part of it which I wanted to talk about is, how do we understand that the water intake that we are doing is right? Because there has been a lot of message going on, drink 8 glasses of water per day. But if I see if I'm a resident of an area where there is a lot of humidity, which means I sweat a lot. So, consuming good amount of water will obviously, I'm sweating, so it will keep me away from dehydrated. But at the same time, places where there is no or minimal sweat, which is like zero humidity or very minimal humidity, in those areas, the 8 glasses of water a day might be a little too dicey or too much, to overhydration. So how do we understand whether our body needs more water, or what is the right amount of water to be taken?
For that you have to listen to your kidneys only. What I tell to all my patients, you have to see the color of your urine.
Correct.
If the kidneys are telling drink more water, you have to drink more water. If the kidneys are telling you that drink less water, you have to drink less water. How to interpret the language of the kidneys through the color of the urine, through the smell of the urine. If your urine is very concentrated, I mean it's very dark colored, your body is having less water. I mean dehydration.
Needs more water.
Needs more water, because kidneys are now trying to conserve the water, and that is the reason the urine is getting concentrated. So if the urine color is concentrated, you need to drink more water.
So what is the ideal color?
Ideal color is light yellow. I mean, I'm not very good at diagnosing the colors as all males are. But I will say consistently dilute urine with light yellow color is the good thing. There are various caveats to it also, because if you are taking B complex vitamins and all the vitamins or all the substances which have a pigment in that usually changes the color of your urine. So you have to be aware of that fact. But mostly it is a light yellow colored urine is
straw
good.
color.
Yeah, you can say that, straw colored. The other thing, if your body is overhydrated, kidneys will be throwing out all the water which you have drink. I mean, if your body is requiring only 1.5 to 2 liters of water, and just because of some habit you are taking around 3 or 4 liters of water, then the excess of water is thrown out through the urine. So urine gets very diluted. It just looks like a water.
Yes.
So if the kidney is throwing out water, you have to look, and kidney is saying, yeah, see, whatever you are drinking, I am throwing it out. Drink less. So that is the thing which you have to listen to the kidneys. And if the kidneys is conserving, she is saying, see the color of your urine now. Now you have to drink more water.
Ideally, the color of the urine.
Color of the urine, it matters. Absolute numbers do not hold any significance. Like 8 glass, 6 glass.
Keep a close eye on the color of the urine, preferably straw yellow color.
Yeah.
And unless you are taking some multivitamins or something like that.
Yeah.
But usually it's like straw yellow color.
Straw yellow color. And secondly, those patients who suffer from stones, they should target their urine should be like watery. I mean, dilute urine. The most efficient and the cheapest and the free medicine to prevent the stone and to prevent any kind of kidney disease also, I will say, is the water. So if you are drinking adequate amount of water, you are giving adequate amount of raw material to your kidneys to excrete all the waste products.
Flush out all the waste products
which are in the blood.
Hmm.
So you have to look into that thing. And all the stones patients who have any a single episode of stone also, they should be targeting their urine should be like white, watery or transparent thing. Something like the urine should be very transparent or very diluted urine. So that is the only way they can be preventing further occurrences of the stones in the kidney.
So that was about the preventive aspect of it and the routine checks that needs to be done for a healthier kidney. So moving on to the next segment of it, which I have a few lines which are typically myth or fact, and a few questions which are very frequently asked. So let's hear it out from you. Drinking 8 glasses of water a day is perfect amount for everyone. Myth or fact?
Yeah, it's a partial myth and partial fact. Absolute numbers do not hold any significance. I told you earlier, because 8 glass of water will be very less for a person working in outside in a field in a Mumbai, but that will be very much higher for a person who will be working in a Nasik. So it all depends upon the environment in which you are moving.
Correct.
So 8 glasses of water is a good measure, but you have also to look at your urine color.
Okay. Foamy urine is just from dehydration and not a sign of kidney problems.
No, that's a myth. It is a sign of kidney disease. In dehydration, you won't be getting that much foamy urine, and it usually in dehydration, it is a reversible thing. You drink lots of water and then everything goes away. But persistently having a foamy urine is a sign of kidney disease. You have to go to a doctor and check yourself up. I mean, you have to get yourself checked. Yes.
Yeah. Painkillers are harmless if taken occasionally.
No medicine is harmless.
Safe.
No medicine is safe. From my perspective, any medicine on the earth is unsafe. But you have to believe on the buffering capacity of the kidney. But painkillers are the greatest evidence. Something like Shakal. They are Gabbar and Shakal. So they will be causing more damage to the kidney.
So it's best to avoid them.
Best to avoid.
जितने देर तक हो सकता है.
Yeah, or you have to take under guidance of the doctor only. Yeah. They know. You have to believe and trust your doctor. They know how much painkillers are required and what painkillers are required for your particular pain degree of pain.
Degree of pain. Kidney diseases only happens to older people.
No. We are treating persons. I mean, we are treating patients from 6 months of age or 6 days of age to 94 years of. So
kidney doesn't see any age.
No. Kidney does not see any age. Kidney is an organ. Kidney is an organ inside the body. If it is not developed properly when the baby is inside the uterus of the mother's womb, then it starts the symptoms starts manifesting right from the birth. And many times the disease take a very long course to manifest. So at later stages in life also, like more than 70 or 75 years of age, we get many of the patients who are having kidney disease first time in their life.
Achha.
So age is not a criteria parameter to be followed.
Age is not a number here.
Not a number, yeah.
Okay. All type of salts are equally bad for your kidneys. Rock salt, pink salt, white salt.
Okay. So I would go off track and tell you that kidneys have developed a tremendous capacity to retain whatever salt you are taking, and the salt you are putting in your food is actually an excess of the salt. Your body does not usually require that amount of salt. All the sodium and chloride your body requires, you can get it through your normal balanced diet or balanced food. So excess salt is usually excreted out through the kidneys. So what amount of salt is safer? So they say that around 5 grams of salt in a daily diet, in daily Indian diet, is what is adequate for you to have a normal test. For those suffering from hypertension, they should be limiting their salt intake as low as possible. And all those who are suffering from kidney disease, they should be limiting their salt intake very drastically. At the end, salt is what is putting more strain on your kidneys rather than any other chemical or any other food ingredient. So restricting your salt intake is what is helping your kidneys out. Secondly, about those Himalayan Senda salt and all those low sodium salt. Low sodium salt contains usually potassium. Instead of sodium, they are putting potassium. Potassium is good. It has an antihypertensive property. So it is good in a manner that those who have normal kidney should be taking it.
Mm-hmm.
But those who are having some kind of kidney disease, that is very harmful for them.
Mm-hmm.
So low sodium salt is very harmful for all those patients who are suffering from kidney disease, because high
Achha.
potassium levels in the blood is fatal thing.
Is again another
Yeah, it's I mean,
red
we
flag.
are it's very difficult for us
Mhm.
when the patients come to us with a very high potassium levels
Mhm.
to treat that high potassium levels. So you should
Mhm.
not be putting that much potassium inside your bodies, because the kidneys when they start failing, they get a limited capacity to excrete whatever potassium challenge we are giving to the kidneys.
Okay. Next one is frequent nighttime urination is always just a sign of aging, because
No.
usually it is said that frequent night urination, people directly link it to prostate enlargement or something like
Yeah,
that.
in males, yeah, it is a sign of benign prostatic hyperplasia, what we say in medical
Yeah,
terminology.
yeah.
It is in simple language, I can say, just because your hairs are grayed, the other organs are also aging.
Mhm.
And among them, in males, in men, I will say, the prostate is enlarging and it is getting harder.
Hmm.
So it causes an obstruction to normal flow of the urine.
Correct.
And that is the reason they have to go very frequently to pass the urine.
Hmm.
Yeah, it is a sign of an aging, because the
Hmm.
prostate is enlarging. It is also a sign of a disease. It is
Yeah.
a benign disease. Benign
Yeah.
in the sense it is not causing you much problem
Hmm.
in acute phase. But it is just at the end of quality of life. How much ever you say, but getting up in the night around 4 or 5 times, it very disturbing.
Yeah.
And the sleep gets disturbed. Everyone else
Correct.
also gets disturbed. You are flushing
Yes.
your toilet
Yes.
5 or 6 times in the
Yes.
night. So that is the thing.
Yes.
But other kidney diseases such as uncontrolled diabetes or
Yes.
other diseases which
Even urinary tract
urinary tract
infection as
infections,
well.
yeah, urinary tract infections, uncontrolled diabetes,
Hmm.
kidney disease in later stages
Hmm.
may also lead to such kind of manifestations, increased urinary frequency in the night.
Hmm.
So you have to look. I mean, if anything is, I mean, your sleep is getting disturbed.
Hmm.
That
Then
is the
it's
criteria.
worth the
Yeah,
notice
yeah. You have to
bring
work
it
up.
to notice.
Yes, that's the thing.
Right. If your urine looks clear, your kidneys are perfectly fine.
You can say that.
To
You can
certain
say that
extent.
to certain extent. You can say that if the if it is not smelling very funnily, if you
Mhm.
if it is not smelling, out of what it should be smelling, I will say. Then, and if you are not disturbed in the night for frequent, I'm passing the urine very frequently, and
Hmm.
you are getting adequate 6 to 7 times. You need to go to the urine
The
6
urge
to
of
7 times in the
urination, 6 to
urge of
7 times.
in the daytime. Then you are healthy. The kidneys are healthy.
Okay. One test everyone over 40 should get done every year for a good kidney health.
From kidney point of view, serum creatinine and urine routine microscopy.
Okay.
A basic urine test and a basic serum creatinine test. These are the two tests which gives you lots of information.
Noted. More dangerous for kidneys, high blood pressure or high blood sugar?
Both.
Both?
Both. And if they come, I mean, these are like good friends. High blood pressure and blood sugars or diabetes, they both are friends. They usually do not come alone.
Yeah, they come.
They come together.
They tag along.
Yeah, they tag along. They come together. Most
True.
of the patients who suffer from kidney disease are suffering from diabetes and blood pressure both.
Hmm.
So these are the numbers which you should be looking at.
Hmm.
Your blood pressure should not be very high, and your
Mhm.
blood sugars should also not be very high. Blood
Mhm.
pressure and blood sugars, they have to be kept within normal range.
One daily habit that supports kidney health. One good habit.
Okay, so drink lots of water. Water to an extent that as I told earlier, that the urine colors is straw colored and light colored urine. That's the thing.
So basically, stay hydrated.
Stay hydrated. Secondly, don't take over the counter medications or unprescribed or unsupervised medications. And thirdly, if you have any risk factors, you have to be alert. You have to keep reports checked. I mean, yourself checked.
Tea or coffee, which is harder on kidneys?
Both of them are good. I mean, tea or coffee. Actually, they say that coffee has some antioxidant properties.
Yeah.
But these antioxidant properties are for general, well-being. Tea and coffee, they both are. I mean, they don't have much, bearing on the kidney health as a latter thing. I mean, latter or anything. I mean, if you can just notice that lots of tea, lots of coffee will cause you to go visit the washroom more frequently, because some of the coffees, there are many brands and many types of the coffees. They have a diuretic property. Diuretic property in the sense they are stimulating.
Increased
They are
urine output.
stimulating your kidneys to pass more urine. So that being said, high amount of tea, normal amount of tea or coffee usually do not harm the kidneys. Yeah, if you're taking large number of coffee just like to stay awake and all, that usually that may lead to high blood pressures, and that in the long term will be harmful for your body. So that's the thing.
Okay, so that's about that. And before we end today's podcast, we would want to discuss a case with you. I mean, you can share some stories with us about a challenging case which was really close to your heart, which you have seen.
See, ours is a critical care branch. I mean, when the kidneys are affected in patients, the patients are usually very sick. And I'm talking about all the patients who present very acutely with a short history, duration of their illnesses. So day in and day out, we are dealing with many of the cases who have, all other organs affected, and the kidneys are also affected. And we have to look into everything to treat the kidneys. So I will categorize now. I won't be putting any particular, a case, because it would be like not doing justification to other person. Every case is challenging to us, because as and when the kidneys are affected and other organs are also affected, we have to look into other organs, the health of other organs also. So there were many patients. Recently, I had a patient who was very young. 25 to 30 years. He was 36 years of male person. He was a social drinker, and then he suffered with some kind of infection of the stomach.
Achha.
And then that infection got aggravated, involving all his major organs.
Achha.
Like liver was involved first, then lungs were involved, then he had a severe low blood pressure, so he required very high amount of medicines to keep his blood pressure in barely permissible range, so that his organs are perfused. And we have various scores in an ICU. Why? To prognosticate the disease, so that we can give a clear picture to the patients relatives. So the score was like he had a risk of dying of around 70-80%. Then we counseled the relatives. It was a very emotional thing, because the patient was an only son, is the only son, and he was staying outside for very long, and they brought him here outside, in Dubai, some Middle East countries. And then he came here, and he started having all these symptoms. Then we started him on CRRT. CRRT is a continuous renal replacement therapy. It is a continuous, it is kind of a therapy which we utilize in very sick patients. It is our effort to keep the internal system, all the biochemical reports as normal as possible, so that other organs get time to heal. And the timing of initiation of that particular therapy is very crucial. Many a times, considering the cost of the therapy, people usually do not look into that or do not opt for that therapy. So we counsel, and then our hospital also helped very much. They reduce the cost of the therapy, and they usually do that. So they reduce the cost of the therapy, so that we could, the patient could afford that. And after 3 days of that intensive therapy, he started showing signs of improvement. His reports were aligning with what we were projecting, and then gradually improved. He came out. He lost a significant amount of, muscle mass also, but he came out. He went home, and he, came to follow up also. This is just a representative story, I will say. We are dealing with such kind of patients day in and day out. The most important challenge for us at that particular moment is to not do harm to the patient. The patients are so fragile. The physiology has become so fragile. All the organs are failed. Now, if I am, offering them another therapy, the main target and the thing which is going in my back of the mind is like, this therapy should not be harming him. Yeah. If it is not helping him, it should not be harming him, and
not causing further more damage.
And these therapies are very technically demanding. We have to manage many parameters in that therapy. And so, that gives us, sleepless nights sometimes, I will say. So we are treating such kind of sick patients in here. Then there is another category of patient, emotional challenge, I will say. So there are very young patients. We have treated recently a very young patient, 16 years old boy.
Achha.
He was the, I will say every boy is a precious, but he was a precious boy. Because they could, the mother could get pregnant only after not 12 or 13 years of marriage, and he was the only surviving boy.
Achha.
He was a kind of, challenged also, some sort of educationally challenged, I will say. Then he suffered from pneumonia. And then, as the story goes on, he was treated peripherally outside. Then he came and he was in very bad shape. As I told you earlier, the chances, the score which we did when he presented to us, the score of dying him was, the chances of him was, his mortality was around 70-80%, the same as that was the previous person.
Achha.
But then we started therapy. Everyone was very aggressive, and they were expecting. Since he's the younger child, and the young boy, and he's precious. He's precious for us also, but he was, so as I was saying, every patient is very precious to us. But this was a young boy, and the definition of preciousness was something different for his family. We started him on some kind of the recent therapies, and he started showing improvement in that. But later on, his course was very prolonged. We were projecting that he should get better within 15 days, but he stayed in the hospital for around 1.5 months. But at the end, he went home. The intense pressure, the emotional pressure which we used to experience during every time we used to go to the counseling room and counsel the relatives about the father and the mother,
the progress of the treatment,
the
what is
progress of the
happening.
treatment, and the patient was not showing much significant improvement
to be updated to the family.
So that these are the kinds of patients, that put a kind of emotional pressure on you. You also get involved in that, because you are seeing that young boy and you think that something should be done and you can do some change and some difference. So these are the kinds of cases which put an emotional pressure on us. So these are two categories of patients, the challenging cases and the patients, what I want to highlight.
That's lovely to hear, and such beautiful cases and prognosis. Wishing you many more success for all your future endeavors. And once again, we want to thank you from the bottom of our heart for giving us some time on Sahyadri Health Talks.
Thank you.
Is there any final message that you want to give out to all the viewers out there?
I would like to listen. I would like all my listeners to listen to your kidney. If you're listening to your kidney initially whispers, but then when it starts crying, the time has passed. So you have to listen to your kidneys. You have to get your blood values checked at least once in a year, and just see to it that you are not taking unwarranted medicines and unwarranted supplements. So that's it.
On that note, listen to your body, listen to your kidney, get an annual health checkup done, and reach out to your doctor when you need it.
Thank you.
Thank you so much, sir.
Thank you.
And signing off, Dr. Tushita, Sahyadri Health Talks.